our show today, we are going to welcome our guest speaker for us today, our guest on the show, and she is in the person of Dr. Afia Antwi-Nartey. I have to cut some of the names short because. All right. Well, let's give it up for our doc. We are so excited to have you on the Life and Health Show. Incidentally, this is, I think, your second or third appearance on the
It's
show.
third.
It's a
It's my
third
third
appearance.
time.
Yes.
Yeah.
And we're so happy to have you again on the live. You know, your husband
Thank
has been dodging us, but we'll get him eventually.
you. Right. You got it.
Yeah, he's a busy man, I understand. All right. So you just want us to, I mean, before we go ahead with our questions and stuff, just tell us a little bit about yourself, and then from there we will move forward.
Okay. So I guess brief professional history. I'm an optometrist. I think now this is year 11 for me in practice.
Wow.
We have a private practice in West Hartford, Connecticut, which has been open now for 3 years, going on 3.5 years. And we do general optometry, or what we call medical optometry, where we manage not just vision, but also some medical implications. Because as we've learned, the eye is not isolated, it's part of a body. And so whatever is going on in the body also, will translate into the eye. So out in West Hartford, Connecticut, and by the grace of God, we have two kids, husband, keeps me very busy.
Yeah, I always wonder how you are able to juggle all that and still be
uh,
active in church too.
Yes, definitely. That
a
is.
lot. It's a lot. I'm not gonna lie. Definitely a lot. But you have to do it. So we make time. We make time to do it. But it's definitely a lot.
Yes,
Good job, good job, good job. You are an
you're doing very
inspiration,
well.
inspiration to a lot of upcoming young practitioners and some of us also. All right.
Yeah,
So
glad to.
we are happy to have you. Now, our topic, as you may have seen, as we're talking about getting blind slowly, uh, with cholesterol being a culprit, and as we know, a lot of people don't think about the eye when they talk or think about health. Everybody wants
Mm-hmm,
to talk about their diabetes, their heart attacks,
mm-hmm.
all the other stuff. But they forget that the window to the entire body is these two balls that we have.
Yes.
And so it's
Mm-hmm.
important that today you do justice to it. Let us see how our health may be affected by our cholesterol levels if it is not managed. So, with that being said, we have some questions for you, and just
Mm-hmm.
feel free also to share or throw anything that you want to add apart from the questions that we will ask. And I want to try
Okay.
and make it as conversational as possible. So, again, welcome to the Life and Health Show. I am Otin and she's Gifty, and our show is the Life and Health Show on the Dr. Otin's channel. And I also hope that as we go ahead, you can also have the chance to share with your community, your
Mm-hmm.
followers, and people that may benefit from the show. So, with that being said, I think we have some questions, and we're going to go right onto them. The first question is below your screens. Can you explain to our viewers the relationship between high cholesterol levels and eye health? Let's start off with that.
So we'll start off with that. And just as initially I was saying, the eye is not isolated.
Hmm.
It's not just an organ of its own. It's connected to the body and connected by various things. The vascular system or our blood vessels, and then also connected by the nervous system, which the brain. And so something that occurs in the brain can have implications in the eye. Something that occurs in the eye can have implications in the brain. Same thing, something that is happening in your body, as long as it can go through your blood, can have implications on your eye. And that is why or how cholesterol comes in, because high cholesterol levels, as you know, the doctors or Dr. Gifty and Dr. Samote, as they have described or discussed over the last few months of the discussion on cholesterol, because cholesterol, HDL, LDL, is going through our bloodstream, it is also going to be carried into our eye. And the level of severity, which we are going to get into as this talk progresses, determines what we do about it, where this cholesterol is accumulating, where it's traveling from, has very severe and very major health implications on the eye. Some are mild, benign, even some that we just monitor and move on. But there are some that can be emergencies, life threatening, and also vision threatening emergencies when it comes to cholesterol and its accumulation in the body, which now translates into the eye. So, as this talk progresses, that will be something that will be made known to everyone, so that in the different degrees of intensity or emergence, some that require you to go to the emergency room right away, some that requires you to schedule a follow-up with your doctor. But my hope is, after the discussion today, that we will be all sufficiently educated, so that we will know that, okay, so because there are some people, they come in like, okay, I see you're on cholesterol medication, and oh, am I? That they were just prescribed it. They don't know their numbers. They have
Mhm.
zero implication on why managing the cholesterol is important. Or some are just, high blood pressure, and my doctor gave me this. And so there's always a very big confusion. Some think it's just high blood pressure medication. So you say, no, this is a cholesterol medicine. I know my cholesterol is fine. I don't have any cholesterol issue. So as much as we pay attention to high blood pressure, as much as we pay attention to diabetes, the other big one to also pay attention to is cholesterol. And so, hopefully, by the end of this afternoon's discussion, we'll be well educated to understand the role or the relationship between the cholesterol and our eye health.
Thank you so much. You know,
So, why is it that this aspect is always mostly overlooked when it comes to the eye?
I think it's because when, like in terms of diabetes, in terms of high blood pressure, when the symptoms, or when the side effects, I should say, or the implications come about, is there. Like, for, I'm sure if those who have watched the show for the last few years, when we had our discussion on diabetes, diabetic retinopathy, you'll see there'll be bleeding, but also it's because people notice a change in the vision. Because most often, several times I've diagnosed people with diabetes even before they even knew, and it was because, oh, I can't see, things are blurry, I'm not able to see as well. Sometimes I've had someone come in, they had blood sugars of 1,000.
wow.
Yes, and they weren't even aware.
Mhm.
How they got to discover this diagnosis of diabetes was because there was a change in the vision. And we see that varying blood sugar levels will cause a direct shift in the vision. So that causes people to come in. And also is because the primary cares are always, hounding, go get your eyes checked, let them look at your retina. When it comes to high blood pressure, because there's the risk of a stroke, and also those who have high blood pressure, sometimes if the pressure increases, most people will feel a physical unwellness.
Right.
uh, some will say they are having headaches, some just feel uneasy. So there is some physical push or some physical experience to say, okay, there's something going on. Unfortunately, with cholesterol, it ends up not being like that until you are at the pretty uh, dire end where your carotids are blocked. You're not
Mm.
being able to get much blood up into your eye and into your brain. That's when most people will start to notice symptoms when it's almost too late. I've had a patient of mine recently, we were discussing, he had 90% blockage.
Wow.
90%,
Wow.
and he's a contractor. He was walking around. How he was able to make it was one day he was just out of breath, like, what's going on? His wife drove him to the emergency room against his will, and that's how he's alive.
Wow.
And so at 40% blockage, nothing, he was fine. At 50%, he was fine. 60, 70, it wasn't until he was barely getting any trickle of blood flow because his arteries were so blocked. And he had to undergo a triple bypass. So that's why cholesterol tends to be overlooked, is just because from I think it's so slow in building up that it's almost like flying under the radar.
Mm.
But hopefully we can understand some of these things and pay closer attention to the cholesterol and its relation to our eyes.
My goodness.
Okay.
My goodness. That's a lot. That's a lot. All right. Yeah.
That's
So
true.
hopefully
Mm,
people are going to pay attention.
mhm,
It's better to get it done than to wait until things become late, and especially with the eye, because once you lose the sight,
mhm,
it's gone for good. My daughter was volunteering somewhere, and she was telling
mhm,
me of one of the things she did recently was taking care of a person who has been deemed legally blind, and this
mhm,
person is in their late 50s. I'm like,
mhm,
50s, actually not late. I don't want to give too much details, but basically middle age, 40
mhm,
something to 50s.
mhm.
And according to her, she cannot do anything on her own. She has to
Yeah,
get help, and the state requires that somebody helps them, no matter
yeah.
how you
Mm,
think you can even do it. So some of these things
mhm.
are very serious. you know
Yes,
uh,
very.
yeah. So
And you mentioned also that the symptoms is so quiet, like you
yeah.
don't
Mm,
feel anything.
Yeah.
So if it's
mhm,
high, you don't feel any change,
Hmm.
yeah,
nothing prompting you that on until to the point that it's too
yeah,
late, that something
yeah,
has really gone wrong before you know that you have to
yeah,
follow up, which is very
yeah,
serious. So we have to
yeah.
really follow up on that.
Yeah, and
Yes.
that's the unfortunate thing with some of these silent issues or silent conditions is you're unaware. You're unaware
Hmm.
you have that
Yeah.
going on. It just flies under the radar, and then before you know it, when you actually have symptoms, then it becomes too late.
So
It's too
Uh,
late.
yeah, which is the unfortunate thing. Because you'll be walking around thinking you're fine. In the case of this patient of mine, he was a contractor, so he was, doing
oh
stuff,
yes.
heavy lifting and all of that. Until he's like, one day he just felt like, I'm not well. And
Mm.
his wife, against his will, was like, no, let's go to the emergency room. And then boom, so it's definitely something that we need to, draw our minds to, draw our
Mhm.
attention to. and then be well educated enough so that we can take the necessary steps to be able to ensure good health and well-being.
All right, that's good. My goodness. All right, so we're gonna go to our next question, and I think if you can read that, if you can see it. Yes.
So, what are some of the lesser known eye conditions and diseases that can be directly or indirectly linked to high cholesterol?
Okay, so when it comes to the eye, I guess the good thing is let's tackle the lesser known things on the non emergent, I should say, the non emergent things, and then we can devote time to the more serious things, I suppose. So, one thing we call arcus senalis, and I was trying to get my images here just so that I could people can see, but
Share
most
with
of
me.
the,
If you want to
oh,
share, I'll get them and I'll throw them.
oh, okay, all
You can
right, and then
share on your
let
PowerPoint play.
okay, then I'll do that. It's called arcus senalis, but whilst I click these buttons, let me let me give an intro to what arcus senalis is. If you've ever seen, sometimes you see, especially as of African descent, there's like a whitish ring around the eye. I've had people come in and they're like, "Doctor, my eyes are changing color. What is going on?" We call that arcus senalis. And so, which is deposit of cholesterol on the cornea. And
Oh
so
wow.
let me share this image so that everyone is able to see it. And what it is as the cholesterol is going through the blood, when it gets into the eye, because of the structure of the front of the eye, we have these little trickle down deposits of cholesterol on the cornea, and it leaves a whitish ring for some people as time goes on with age. But if the person is younger, and by younger we mean 40 and under, sometimes 45,
Mhm.
we run a cholesterol panel just because that is a direct indication. 9 out of 10 times when we do, the person's cholesterol is high. And so doing looking at the eye, you come in, we take a quick look, and several times people have asked me, "Doc, what's going on with my eye? Why is my eye changing color?" And I say, "It's your cholesterol." I always get that puzzled look, like, what?
What?
How can my cholesterol deposit on my eye to change color? But it happens. We call it arcus senalis. And so that is one of the things that when we see, it doesn't require treatment. It requires, having the person get blood tests done, manage the cholesterol in the way that typically it would be managed, as in, with medication, diet changes, and it's not vision threatening, as in arcus senalis will not lead to blindness, thankfully. However, that change in the coloration of your cornea is permanent.
Oh,
It doesn't reverse. And so, almost like you see someone is like, why do their eyes, the eye color look different? And that's because of the deposit of cholesterol
Does it
on
does it
retina.
change color to yellow? As in
No,
cholesterol color or no?
unfortunately, it, unfortunately, it does not.
I hope it doesn't change to blue or something nice.
that would be nice. Hazel.
No, it's very stark. Like when you see it, you're like, huh. These eyes look different. It's not the normal presentation
Okay.
of the eye, of the cornea of the iris, and so most people are concerned just because of the cosmetic appearance. It's like there's something wrong with my eye. What is going on? And usually we just tell them, okay, go see your doctor. We'll run these cholesterol tests and then manage your cholesterol that way. And thankfully, when it comes to that, Arcus is not vision threatening. It does leave a permanent change in the color of your cornea, but at least your vision is still intact. Another thing of note is, which is also non-emergent, non-vision threatening, we call xanthelasma. And
Yes.
xanthelasma is deposits of cholesterol under the skin of the eyelid. And I'm going to use myself as an example. You'll see cholesterol deposited right here and right here. And so people will come in and you have a like a plaque right there of
Mm,
cholesterol deposited. So cosmetically, it doesn't look the best. And that will not cause any change in vision, but again, it's not cosmetically appealing. How
mm,
we manage that, that can be managed, or it is managed. They cauterize, use laser to burn it off. And that you would see the plastic surgeon or an oculoplastics doctor to do that. So that is also an indication. A patient comes in, you see that you have to have that discussion of their cholesterol levels with them. And then if they are not being managed with medication, then still same thing we do with ARCUS. You run the blood test, or you do the blood work for cholesterol, and then have them managed that way. And then with the deposits of cholesterol on the eyelids, the upper and the lower eyelids, that gets removed, and then people can move on. So xanthelasma, again, is also another one of these uh, changes or side effects or repercussions that come as a result of cholesterol, but thankfully, it's not vision threatening.
mm.
Um,
The
the rest,
question before you
oh,
move
yes,
on. Yes,
yes,
so
please.
is it more pronounced in the lighter skin over a darker person? Because I don't remember seeing anybody with that uh description that you
Um,
just made.
So it's not because of how it presents. And I was trying to share my screen, but I'm having some technical difficulties. It wants me to switch my browser. Nah, I don't want to do that. So that's
No.
why I didn't share it. But it's pronounced. So whether it is in a lighter skin tone or a darker skin tone, it's still evident. Sometimes, if you have folds on your eyelid, then it's able to kind of camouflage it or hide it. But because the skin is raised in that area, it is noticeable. I have seen it in both light skin and dark skin people, although I guess percentage wise, I have seen it in more of the Caucasian patients of mine than even the Hispanic or people of African descent. But with how it appears, it's definitely noticeable. It's not going to fly under the radar. It would be noticed for sure. So that is that. And thankfully, xanthelasma also is not vision threatening, which is, but most of the things that come with cholesterol tend to be vision threatening. So that's one of the other things that comes as a result of high cholesterol levels that does not threaten the vision or cause changes to the vision. Arcus and xanthelasma both are cosmetic issues.
All right. Oh, you have another question. All right. Let's see what next. You want to go?
Yeah, I think were you getting to the point of talking about the one that affects the eye? Because he kept saying these two does not affect the
Oh,
vision.
you said, yeah.
Yeah,
So the more serious
the more
ones.
serious ones.
You said the less
Yes.
serious
So
ones now.
so
If you
yes,
want to,
there.
if you want, we can take a break, and if you want to load your images, if it's going to be very helpful, then I would. You think you want the images still or no?
I mean, with the two, with the xanthelasma
Mhm.
and the arcus, definitely seeing it that will, carry the message. Like you see, like, oh, okay, what's
Yeah,
this? And so yeah, I think it definitely would be helpful to, and also you when you see it now, you'd be able to identify it because we get a lot of questions. And so when you have it and you look at yourself in the mirror and you're like, oh, so this is what she was talking about. I think it will drive home the message a little bit more. So if we're able to, take a, commercial break.
yeah. Let me see if we can. We couldn't get the images of our doctor on the show, but we still want to proceed with the show because she's going to be able to power through by describing uh, what is happening with her eyes with us, and hopefully in the future we'll be able to post those for you. All right, so we are going to go back to the question that we had, and our next question is: are there specific warning signs or symptoms related to high cholesterol's impact on eye health that people should be aware of?
Yes, there are. Typically, because of how cholesterol would affect the eye. So we've discussed, the less serious things. So when it comes to the more serious things, because of how it affects the eye, that will lead to the symptoms. First being the eye's relation to the brain, and then the eye's relation to the heart. Those two specific things lead to symptoms of cholesterol. So I'm sure through the discussions of cholesterol, when you have blockage, as in you've had deposits of cholesterol in your arteries, right along here, we have a major branch of blood vessels that come from your heart through your neck up to your brain. The same branch that would go to your brain also goes to your eye. So some people would come in and they're like, I was there and then my vision went black. It lasted a few seconds and then it came back. And so when someone presents a symptom like that, we ask questions really to tease out, are they losing blood flow from the heart to the eye? Because when you're not getting enough blood, that's when your vision will go black.
Okay.
It'll last a few seconds and then it comes back. We call that transient vision loss or amaurosis fugax for the Latin name. And that is an indication of a reduction in blood flow from the heart to the eye. The main concern when you're getting this is if you're not getting enough blood from your heart to your eye, you're also not going to be getting enough blood from your heart to your brain since they share the same root of blood. You're not going to get blood from your heart to your brain by any other route except from your carotid. And so if your eye is giving you signs that it's not getting enough blood, then also your brain is not doing the same. And if your brain is not getting enough blood, then your risk for a stroke, you're on your way. The risk for an ischemic stroke, because there are different types of strokes, but your risk for an ischemic stroke is very, very high. And so that is one of the things, I guess as we go down our list, one of the things of the signs of cholesterol. So when a patient comes in with a complaint like that I'm there and then my vision just goes black and then it'll come back. First thing we do is order a carotid Doppler to see how is the blood vessels, the arteries in the carotid, in the neck, how is that doing? Because
Mhm.
that will tell us, okay, is this person at a risk for a stroke or not? Because the blockages in the carotid will restrict blood flow to the eye, but it'll also restrict blood flow to the brain. And when it comes to severity, although this is a vision threatening issue, it's also life threatening. I mean, if you lose vision and you're still alive, that's great. But if that is going to cause a loss of life, it becomes an emergency. So that is one of those things we call transient vision loss. And that is a direct indication of blockages in the artery. And if there are blockages in the artery, there will also be blockages in the aortic valve. And
Mhm.
so then that leads down further to, is this person at risk for heart disease, for a heart attack,
Mhm.
because of the blockages? And so just that one symptom will now lead to a cascading of things to figure out, because you're not going to just block your arteries and your other arteries in the rest of your body be open, because the blood is going everywhere, is
Yeah.
carrying the cholesterol everywhere. And so transient vision loss, one of these things, as a result of cholesterol, that can mean, okay, you need to get things done, you need to get things checked, because if not, it could lead to more severe things. Um, the other thing also that when we see in the eye also clues us in is with the same cholesterol plaque buildup. The cholesterol builds up, builds up, builds up. Sometimes you get a piece of it that separates and it starts to travel, and it travels again along the arteries. Wherever the blood is going, that plaque is also going. It goes into the eye, and that we are able to see. We look in the eye and we see this plaque in the blood vessels, and that tells us, okay, so when you see that, that right away again is you're getting blood work done to look at your arteries, you're getting work done to look at the levels of cholesterol. Because if you're throwing a plaque in your eye, the same thing,
Mhm.
it is going in your brain. You're
Mhm.
going to block a blood vessel in your brain, which is going to lead to a stroke. So that is also another stroke risk. And that plaque we call Hollenhorst plaque. When you
Mm.
see a Holocaust plaque, again, the patient is, they are getting stents put in, because if you're releasing plaques in your eye and it's evident in the eye, then by way of extrapolation, you can
Mhm.
say you have these plaques also in your brain. And the main thing always is stroke prevention, because of how severe strokes can be. It's life threatening, it's vision threatening, it's lifestyle threatening because of the implications of a stroke. So when we see this, we're doing all of these things, because we need to get on it before something happens.
Wow.
Wow.
So,
My goodness. My goodness. That is scary.
yeah.
That is scary. So there
Mhm.
has been instances where people have had serious diagnosis,
Mhm.
closer, relations to strokes found just because you
Yeah.
looked at the eyes, right? Because of
Yes.
these.
Yeah, there's been several. I guess over now the 11 years of practice, where you look in and you start to have this discussion. Okay, this is what I see, and this is what we need to do, because of the implications of just this one finding
Hmm.
that goes on, and not just that. And so this is, the person is, active, unaware that there's something going on, you see these things and they're able to take these necessary steps. On the other side, you can have someone come in, say, I woke up this morning and I can't see out of one eye. My vision is black. I'm blind out of one eye. I can't see anything. And that is one other aspect of this, is when you block an artery enough, if it's a big enough plaque that gets released and it's not going into the brain but is going into the eye, you stop blood flow because the artery is carrying blood from your heart to your eye or to your brain. And so if it's enough to block a major artery, you cause what we call an ischemic attack, as in the retina no longer gets blood and
Mm.
it dies.
Wow.
And
Wow.
this happens, we need to do something within 5-10 minutes of this incident happening because we run the risk of permanent vision loss. And this is not vision loss as in it's blurry, it's vision loss as in it's black. You don't
This is
see
what I
anything.
would call eye attack, as in heart attack, right? My
That's
goodness.
Attack.
Hmm.
and so sometimes we just term it in layman's terms as an eye stroke.
Eye
Um,
stroke.
Stroke. Okay.
yes. And the technical or the clinical term is a central retinal artery occlusion, where you get the blood vessel, the major blood vessel that is sending blood from your aorta, from your heart to your eye, gets clogged or gets blocked by by a plaque, a cholesterol plaque, and now the eye no longer receives blood, and so the tissue in the retina dies.
Mm.
And sometimes, if we're able to address this soon, get the necessary interventions done, sometimes people are able to gain something. But in my experience, if it's a central retinal artery occlusion, 90% of the time
Oh.
it's complete vision loss. And so that is again, and if it's happening, so when someone gets this, that's not the end of it. We still have to do all the necessary precautions, because if the next plaque goes up into the brain,
Mm.
that is a major stroke.
Stroke.
And so even after dealing with, oh, I just lost my vision, we still have to be on it, because okay, the next time it could be your life. And so we
Mm.
have to take the necessary precautions and do the necessary interventions that is needed to keep the arteries open.
Wow, my goodness. That's a lot of danger right there. That is dangerous. My goodness. Just
Yeah.
imagine losing
Mm.
your sight because of high cholesterol
Wow.
plaques breaking off to block that, what do you call it? Central retinal
Retinal
occlusion.
artery. Yes.
My goodness.
Wow.
My goodness. You have
So, Doc, can we say that some people, sometimes you talk to some people and they'll be like, I don't want to go because if I go, they scare me so much because they would be telling me things that are so scary. But I'm living my life, I'm fine. So, what's the
Uh,
point of me going for them to scare me like this? Because right now I'm really scared. So,
oh,
can
I
you
mean,
close?
ignorance is bliss,
Yes,
you
it's
know.
bliss.
And so the thing is, do you want to be proactive, or do you want to live in the unknown, the what if? If you don't mind to just, live your life and not know and not be able to prepare, then, but I think most people would rather, and this is the thing. I've heard this so many times.
Yes.
I had a patient once come in. As there's a number of things that can happen in the eye, one of which is cancer. You can have melanomas in the eye. So this lady came in. She hadn't had an eye exam in over 15 years. So
Wow.
I look and I'm like, this is what I'm finding. I take pictures of it, I show her. this is a concerning lesion because of its appearance. I think you need to go see an oncology so that they can, type this and see if it's benign or if it's. And I just like, well, that's why I never wanted to come in. That's why I had spent. But then when we catch it, then we can do something about it.
Yes.
Because if not, then you, and again, melanomas, as common as they are, they can also, again, your eye is too close to your brain for you not to pay attention to the eye.
Mm.
Because when it's leaving the eye, likelihood that is going to your brain is so great. And so that's why we get so passionate with things of the eye, because of the brain is so close, and that you want to make sure there's nothing going on in the eye that could potentially now hop on to the brain. And so there is that school of thought that, I don't want to come in for you to tell me something scary, but if you know, then you can do something
Yeah.
about it rather
Knowledge is
than it
power.
being too
Mhm.
late. Because it's too late. There's nothing we can do. And unfortunately, I've had the unfortunate incident of having to now have this discussion with people where it's like, we can't do anything about it. If you had come sooner, if we had found it
Mm.
sooner,
Mm.
then we can do something about it. And so, as much as it's scary, you are able to now be as proactive as you need to be. That's why yearly exams are so important, because nothing gets missed. We're able to catch it early. If we need to do anything about it, then we can do it about before it becomes too late. Because usually the too late scenarios or too late situations is because people were not keeping up with the tests and the exams that needed to be done.
My goodness, that's a great presentation that we got from our brother Ben. Thank you, Ben, for commenting. That is good. We are enjoying ourselves here for all that great info that we are getting.
Mhm.
it is unique what the eye is, and
Yes.
if you get somebody who can tell you a lot like this, you have an advantage, especially because it is the entry point to the entire body. That this is a unique organ. Yeah. If you get
Very
a
true.
heartbreak, you have to use your eyes to see somebody cheating. Your eyes. If you're going to enjoy your husband or your wife, you have to have your eyes
Yeah,
seeing.
it's true.
Every good
Very,
thing starts with the
With the
eye.
yeah,
eye.
And so we have to really, really pay attention. And it's so
very true.
delicate that if we play with
Mhm.
it, we can lose it.
Mm.
Play with it.
Yes.
Last presentation, you said something that I'm trying to remember that I don't remember. It was
Mhm.
something that I thought I would never forget. It was one of those catchy things. You know,
Oh, is it about if you're going to go to the dentist twice
Y-
a year for cleaning and you can lose a few teeth,
mm,
but with your eye, even when you lose one and you still have one, it's not the same. So you
Mm.
cannot spare to lose an eye. So at least devoting once a year
Once a
is
year.
not too much to
once
ask.
a
Because
year.
I go diligently. And so that's something I ask my patients all the time. Like, do you go to the dentist? How many times? Twice a year.
Twice.
For what? For cleaning,
For cleaning.
not for what is being done. So if you go for mere cleaning twice a year, then you can at least go to the doctor for the eyes once a year
Once.
to make sure that everything is being checked and everything is being managed and monitored so that nothing slips under the radar.
That's what it is. That's exactly what it is. You say you can lose a few teeth, but you can afford to lose
One
all those
eye.
eyes, even if it's one. Like she's saying,
Yeah,
you cannot easily afford it. The eye is
yeah,
very precious. Thank you for
that's
reminding me of that. It's very important. Now, I think we may have another question here,
okay.
and if you want to read that.
Okay, so how does high cholesterol contribute to conditions like retinal
Oh, I think
fade? Yeah, yeah, I think you
retinal
went over.
occlusion. You didn't mention the
Yeah.
cataracts, though. What about the cataracts?
So when it comes to cataracts, there are so many with cataracts. It's not just one thing leads to cataracts. Age, So there's age-related cataracts,
Okay.
which comes as a factor of just aging and UV damage to the eye. Diabetes can also speed up cataracts
Hmm.
just because of the elevated sugar levels and just by the physiology, how the lens in the eye is. With all of that elevated blood sugar, our lens tends to swell up, and that causes an or hastens cataract formation. Even certain types of medication, people who get steroid injections, say for joint issues, where like knee, and so they get cortisol injections, elbows, wrists, arthritis, tends to cause another type of cataract. People who take steroids, say for autoimmune conditions, rheumatoid, lupus, sarcoidosis, also, we call that posterior subcapsular cataract. Even people who use certain types of eye drops. And so, because of that, the umbrella for cataract formation and the different types of cataract, it's so big. And so, although there is some correlation, it's not direct as it is with retinal artery occlusions, where we know that a plaque released blocks an artery and leads to loss of vision. So, although cataracts can form, there are so many different contributing factors into cataract formation, that we can still say, okay, maybe 10%, 20% of cataract formation would come as a result of increased cholesterol. But we can't just look at a lens and say, oh, this is 100% cholesterol, because of so many different factors that come into play just by virtue of age. In our 40s, we start to have a slow development of cataracts. It takes a few years, but if even if you have, say, a 40-year-old pristine arteries, no excellent levels, just because of the exposure to UV rays through childhood into adulthood, they'll start to have some development of cataracts. So all the others that we've discussed have a direct link. Cataracts, the link is not as direct to cholesterol.
My goodness, my goodness, my goodness. So that being said, if you have high cholesterol and diabetes, and then you are
Mhm.
getting older, then your cataract risk increases, right?
Yes, it does. It does. It
Right.
does. And for, say, uncontrolled diabetes, people whose sugars are fluctuating, we tend to find that they need cataracts done sooner.
Wow.
Uh, just because the increased sugar levels in the eye, the sorbitol, which is what bathes the lens in the eye. When the sugar levels increase, the lens just swells up. It just phenomenal, intrigue. There's no English for that, so I had to throw in the viewers know the English word for phenomenal. Please
Because
take
absorb it. Can you say absorb it then?
Swells, right?
it. So when that happens, it just causes a hastening or a quickening of cataract formation. So most people with uncontrolled diabetes will end up needing their cataracts removed sooner than same age mates, age counterparts who do not have those underlying conditions.
I see. I see. Now we got another comment from my brother. He is saying that your eyes are the
Yeah.
window to the world. That's so true. My goodness, that is
Very
so true. And it doesn't
agree
look
with that.
like we play. It doesn't look like we take it like that. For most people, if we
It's
were
true.
to do a poll, if you watch this, and whether later on or now, if we were to ask for how many people have seen their eye doctor this year once, I'm pretty sure a
Advanced
lot of us are going to say no,
No.
I haven't, because they don't think they are old enough, and yet at
is
least once a year, you know,
yes,
once a year, it's very important. All right, so I
very.
think we are getting close to our time. Let's see if we can throw in one more question. Let's see. So I will go on to my last question. Will be number 5,
Mhm.
and it is: could you, maybe you even answered it, could you share some insights into how individuals can proactively, yes, that's a very good one, proactively protect their eye health, especially
Mhm.
if they have high cholesterol levels?
Okay, so proactively, and I'm sure you've discussed this over and over and over. Lifestyle changes, diet, exercise is important because um, with cholesterol as we know it, uh, mostly is a disease of lifestyle. There is some one rare condition that we didn't discuss. I'll throw that in there since I'm talking about this. We call it lipema retinalis, which is such elevated levels of cholesterol. It some is because they are so bad with their cholesterol, but on a rarer side, there are some people who cannot just break down the cholesterol in their body, and so it just lingers in their blood. And this is where we are talking of total cholesterol levels of 800, 1,000, like insane elevation, where you look at the eye and the blood vessels are creamy white. So
Hmm.
think of milk through their veins and their arteries because the levels of cholesterol is so high. And I've had a few colleagues share, some were just because they were diabetic, high cholesterol, and they were so bad at managing. When we see this type of condition in young children, it's because it's a genetic thing where the body is not able to break down cholesterol. But in adults, it's lifestyle. Their levels of cholesterol is so high, their blood is just thick with fat. Where
Hmm.
you look in the eye and the blood vessels is just creamy white all through because of how terrible the levels of cholesterol are. And how did this happen? Fried food, butter. Uh,
Fried chicken, right?
yes. And so, first thing always, even when we prescribe medication to manage, we always advocate for healthy diet. Um, a diet that is balanced. So not just okay, don't eat any oils, don't eat any fats, but healthy fats, grains, proteins, fruits, vegetables, so that your body is able to gain the nutrients it needs without any being in excess. Because if you're eating too much grains, too much carbs, you run into issues. If you're eating too much sugars, you run into issues. Too much oils, you run into issues. Same with even too much protein. So everything on in its balance, everything in moderation. That's always number one. Also, making sure you're supplementing. Because I was at a conference 2 weeks ago, and we were discussing. We had a presentation on nutrition, and because with the eyes, there's a lot of things that we use supplementations for, or just changing our diet. And the presenter for this conference, what he was talking about, was mentioning some figures. And I recalled about 10 years ago, I had listened to a similar presentation. It was from a different presenter at that time, though. So let me start with what he had said 10 years ago. So 10 years ago, he had mentioned one bowl of spinach in 1950, the nutritional value, where okay, you are getting this amount of nutrients from a bowl of spinach in 1950. In 2013, you would have needed 27 bowls of spinach to gain the same nutritional value.
Wow.
The mind blowing thing is, this lecture, what I listened to 2 weeks ago, said at this point in 2023,
23.
to gain the same nutritional value from a bowl of spinach like you did in 1950, you would need about 52.
Oh my.
My goodness. And we are not even doing one yet.
Wow.
A lot of people
And
don't do even one.
because we are the population overproduction of food, the soil depletion. So the greenhouses where lettuce is being grown in weeks, like you're
Mhm.
talking 4 weeks, is being cut.
Mm.
So it's not getting enough nutrients. Whether it's organic or not, it's still being organic only means that there's no pesticide usage. Organic does not mean nutritional value.
Base.
And so now we are not getting what we need in terms of, so you could eat a bowl of spinach, it's 152
Wow. That would be
of what
anything.
you would have gotten in 1950. And so supplements, I believe, is become very important now. We have to supplement what we are eating with vitamins. So you could have the best diet nutritionally deficient, because we're just not, if you grow your own garden, it's different, because in your garden your lettuce is going to take more than 2 3 weeks to grow. It's
Mhm.
going to be subject to the elements, so it will have to dig deeper in its roots to gain the nutrients from the soil. So if you're able to grow your own lettuce, your own garden, the nutritional value will be far superior.
Mm.
Unfortunately, not every one of us is able to do that. And so, if you're buying from the store, even again, if it says organic, the nutritional value is far less superior. And so, supplementation is important. We need to supplement what we are getting with a healthy diet so that we are not deficient in any vitamins that we need for health and vitality. And there are, a number of vitamins on the market these days. Um, I'll leave it to the pharmacist to discuss which vitamins or which company gives, will make, supplements that will, again, ensure the levels are accurate. But
No, if you know some,
definitely
you can throw
supplement.
it out there.
Okay, so I mean, another thing, and I guess I'll defer to you to corroborate it, is in America, because this was what the presenter was saying, that the supplement manufacturers or the vitamins market is not
Mhm.
regulated by the FDA.
Mhm.
That's true.
And so what he said is, in Australia, they regulate vitamins as they do medicine.
Oh,
And
fine.
so, if you're saying that your vitamin C, your vitamin D, okay, vitamin D is okay, 1000 IUs, they test it to make sure it's indeed 1000 IUs. So now I have to go find Australian vitamins. But, but
Made
even
in
if
Australia.
you're not getting everything, you will still get something, which is better than nothing. So that is my take now, and that is now from that lecture, from that conference 2 weeks ago. Now I advise a patient of mine to supplement, even if, oh, I have the best diet, it's still not enough, because we nutritionally we don't have what we need in, even in the healthiest diet. And so vitamins, there are so many, one a day, Centrum, just to give you an overall boost. Sometimes, if a patient comes and they have such high cholesterol levels where it's showing, sometimes we'll add resveratrol, we'll add fish oil, vitamin omega 3,
Omega.
uh, also on top of the other supplements that we need just so that they are having healthy outcomes and a healthy life.
My goodness, that's deep. My goodness. So with the vitamins in the U.S., yeah, you are correct. They don't regulate it. They are believed to go by the standards of what we call the United States Pharmacopoeia. So when
Mm,
they say the USP, if you have USP on the bottle, it suggests that they are going by the standards of the United States Pharmacopoeia. But then again, I would still take the regulated places
mhm.
vitamin over, who is somebody who is, optionally choosing, yeah, to do that. So yeah, that's a very important point. Now, before we wrap up, though, I think there was one other question. How frequently do you suggest people with high cholesterol should check their eyes? If somebody is already on that, cholesterol medicine, do you
Mhm.
have any particular frequency for them, or just the once a year is okay?
So if there is, let's say someone comes in, we see a plaque, and we are doing all of this, we'll see them sooner. And so the frequency would depend or would be based on the severity. So if it's like, okay, you have cholesterol, you're on medication, but it's well controlled, then we'll just do the yearly. If there's anything that we're managing, sometimes we do 6 months, sometimes we do 3 months, depending on severity. For a Hollenhorst plaque, sometimes it's even much sooner because we need to clear that plaque before we can say, okay, we're okay. We can now maybe resume less frequent visits. So it'll all depend on the severity and what we need to do.
But apart from that, any one of our viewers, if anybody is watching or going to watch later, you suggest that at least everybody should get once a
Yeah,
year, even
yes,
if
once a
they have high
year.
cholesterol.
Yes. And
Okay,
then based on or from that once a year, then we can determine, okay, you need to be seen for
again,
say 6 months, 3 months, but the once a year across the
standard.
board, yes.
Okay. Our last question before we let you go is, if I know you are based in Connecticut in West Hartford, if anybody has no eye doctor, they just want to use this opportunity to come to your practice site and see you, would you be kind enough to share with us where you are located in Connecticut, and maybe
Yes.
your company's email or something, anything that you can share for people? Yeah.
No problem. Happy to do it. So we are in West Hartford. The practice is called Eyes on Park. And by the name, the street is Park Road in West Hartford. The address is 262 Park Road in West Hartford. Phone number 860-206-8818. The office email is eyesonpark@gmail.com, spelled just like how it sounds, EYESONPARK@gmail.com. And we're always, happy to welcome new patients, answer any questions that anyone might have, any concerns. I know when we throw out all of this information, it's like, what is happening? What is going on? But it is best to be educated so that you can be proactive and take the necessary steps that is needed, that is necessary to ensure health and vitality.
Thank you so much. My goodness. Before we let you go, though, we have a viewer question that I want to throw on the board,
Yeah.
and
Mhm.
hopefully you can read it there. Let me bring it up so it will make contrast to show. Yes. It says
Mhm.
that, do we have any latest cures for glaucoma?
So when it comes to glaucoma is, a whole big subject on its own, but I'll do my best to be brief. So with glaucoma, there are different types of glaucoma. There's open angle, primary, secondary open angle. There's narrow angle. There's angle closure glaucoma, and then there's primary. There's secondary. So there's a whole lot. The most common is primary open angle glaucoma. And what makes glaucoma another tricky, not tricky, troublesome is the word I want to use, is because primary open angle glaucoma doesn't have any symptoms. You'll never know the pressures in your eye is elevated, that is going too high. When you start to notice symptoms, usually is because it has now caused damage to your optic nerves. That's when people start to notice symptoms. I had a patient, it's been a few years now. He came to me, he hadn't had an eye exam in about 20 years.
Wow.
His reason for coming in was he noticed that when he's walking, he bumps into the doorway. So we go to look, end stage glaucoma. Like all
Wow.
his
Oh.
nerves were gone. And so he had tunnel vision. And so, based on severity of glaucoma, based on how high the pressure in your eye is, we either will use drops to bring the pressure down or surgery to also control the pressure. There are some people whose pressure is uncontrolled. And
Mm.
so, for those people, surgery tends to work best. If you come and we find that okay, your glaucoma is advancing or it's at a point where we need to be aggressive, that's when we do surgery. And there are different types of surgeries that we can do for glaucoma. Sometimes we'll do a little opening so that we can drain some of the fluid and reduce the pressure. Sometimes they can put a little stunt, a tiny little tube in the eye to also help drain some of the fluid that and reduce the pressure. Sometimes we do laser in the eye to also to help open the drainage and reduce the pressure. When it comes to eye drops, um, there are five classes of eye drops, and the pharmacists will be able the prostaglandins, the alpha agonists, the beta blockers, all of that, the carbonate anhydrase inhibitors. So sometimes we put people on all five if it's uncontrolled, and because compliance is so low when it comes to
Hmm.
and that is because there is no symptom. You are not going to wake up one today and say, "Ah, my glaucoma is acting up." Even with blood pressure, some people will know, "Oh, let me check my pressure. I have a headache. Maybe my pressure is high." You won't know that with glaucoma. And so the motivation to be compliant with these drops is low. So we tend to compound some of these drops just so that we can consolidate it and make it simpler and easier for people. So there are newer drops on the market that are compounded to help reduce the pressure and help keep people compliant. And so when it comes to treatment of glaucoma, either drops or surgery. Those are the two main ways we treat glaucoma. And with the drops, there are some, newer ones on the market that tends to be very effective. All you need is one drop once a day so that people can be compliant. And even then, it'll be shocking to you that people are still non-compliant even when it's just one drop once a day at bedtime for something that could uh, potentially save you from blindness. And so, for newer treatments for glaucoma, it's either newer medications on the market, and there's a new one that's been on the market for about 3 years now. We call Rocklatan, which is a combination of a prostaglandin and another drop, which is not a prostaglandin but works similar uh, to it. Standalone, we call Repressa, and is able to bring the pressure down significantly, even over the first line, which is prostaglandins. And if we are not going that route, then we are going the surgery route, depending on how aggressive we need to. But with glaucoma, it's case by case. Every person and their case is different, and that determines what route we go or what we do about it.
My goodness. I guess I will ask quickly before we let you go.
Mhm.
Like blood pressure, glaucoma, as everybody knows, is
Yeah.
pressure in the
Mhm.
eye.
Yes.
Is there a time that you can say that this person's pressure in the eye is gone, so no more treatment is completely cured, or they will
So
continue to use?
when they do the surgeries, depending on which type of surgery they do, sometimes they do what we call a filtration bleb, where they will cut a small opening and put a little filter so that you can drain the fluid out. Blebs tend to reduce the pressure a lot, to sometimes six, sometimes eight. Um, and to give us context, the range of normal pressure in the eye goes from about 8, the high end of the pressure about 22. If your pressure is over 22, we start to watch, monitor. Over 24, we treat to lower the pressure because that's when it starts to be unhealthy for the eye. So when they put a filtration bleb, bring your pressure down to 8, bring it to 10, bring it to 6, then no drop is needed. Have you been cured of glaucoma? No, because we are still going to have to monitor to make sure the pressure doesn't increase. We are still going to monitor to make sure there's no damage on the optic nerve or no damage into on your field of view. You would stop using drops when the pressure is down in the single digits, but the glaucoma is not gone.
Stop.
So in that case, glaucoma is treatable but not curable. If that's It's treatable but not
Not
curable.
curable.
As in, even when the pressure is low, do you now say I'm glaucoma free? I don't need the doctor? No. You'll still have to follow all the follow ups, all the testing, everything. It's under control, it's being treated, but it's not cured.
Thank you so much. That was deep. Now, if we continue, more questions will be coming. So I guess we'll book another appointment, and definitely we'll start a series on blood pressure, and hopefully we can get your husband on that wagon,
Yes.
and then he will deal with
And the eye
the eye
patch.
part of pressure. So it will be blood pressure on him, and then
Yeah. I
eye pressure on you. So
Mhm.
that is what it is. But while I see it, I'm just going to put this question there, and we are going to close. But you have the chance to, if it's not going to be something long, then you can say something. Otherwise, you can answer it in the Facebook group after. We don't want to keep you for a long time. This may need more, right?
Yes, macular degeneration is also another big one,
Another
like
big one.
which also has, implications to the vision. That affects more of your central vision. And so when I always describe macular degeneration to someone, how I explain it, imagine you're looking at someone and you have something blocking you from seeing them. So if you're going to look at a face, you can't look at the face directly because macular degeneration affects your central vision. So you have to look off to the side to be able to see the person.
Wow.
That also comes, there's genetic components, but then there's also lifestyle components. And that's one of the things where we discuss nutrition, we discuss supplementation, we discuss diet, because that also factors in to how the health of the macula and the course of this disease that causes degeneration of the macular area. There's a lot, so I can definitely answer that question in more detail under the comment section.
All right, all right. We will hit it here then because of time. We're taking more than an hour of your busy Sunday. I know you were into a lot of stuff before we called you for this. We want to say thank you so much for the time. And if you agree, we have already made an appointment. We just have to find a date and we'll
Sure.
get you back on. Yeah, I'm pretty sure glaucoma is going to be an interesting one because most of our population have glaucoma along with
That's
high blood pressure. So they
that's
will go
very
hand in hand. So we'll book an appointment with you and your husband so that we can do that. Viewers says, thank you so much and great
Great
job.
job.
We are
thank
very glad you came. All right, viewers, this is where we will hitch the show. And we want to say thank you again to Dr. Afia Wirekoa Antwi-Nartey for her time. And again, for coming back. This is about her third time. And now we have already made an appointment for the fourth time. Oh my goodness. If I don't get you, who else? My goodness. Thank you so much. So please do her the honors. If you are in Connecticut, support her business. Go visit, and you're not just supporting her business; you are supporting your own
Yourself.
health. You know, we want you to be around to see, so you can watch this show all the time. If you get blind, how are we going to get viewers? My goodness. All right. So thank you so much, and I will get back to you after we close the show. But as we close, we will say, Beloved,
Beloved, we
we
wish
wish above
above
all
all
things
things
that
that
you
you
prosper
prosper
and
and
be
be
in
in
health,
health,
even
even
as
as
your
your
soul
soul
prospers.
prospers.
Thanks for watching,
Thank
and God
you.
bless.